Ngā mihi nui ki koutou katoa. Great to be here. I'm sorry if you were in this room in the last session that this isn't a presentation about how to find a stranger's bedroom in 6.5 minutes. It is a presentation about the consensus statement on comprehensive HIV prevention in Aotearoa. And just a disclaimer, I very much stand here as a messenger rather than the crafter of the consensus statement. And indeed, all members of the HIV Forum stand with me, as well, of course, all the individuals and organisations who have already put their pen to signing on to the consensus statement that was launched earlier in this year. So I've got now about 9.5 minutes to talk a little bit about what the statement is, how it came together, and how we think taking a comprehensive approach to HIV prevention in Aotearoa will give us serious potential to turn the current curve that we're seeing. First of all, I thought it would be useful just to say a little bit about what the National HIV and AIDS Forum is, for those of you that aren't familiar. It's a collective made up of parties working across HIV prevention, care, policy and research in Aotearoa, and the objective really is to serve as a multidisciplinary national body that provides leadership in cross-sector collaboration. So we meet biannually. I currently hold the chair as the ED of the AIDS Foundation, and we identify and debate key issues, providing guidance to relevant government ministries and agencies, and supporting the coordination of HIV-related service delivery by both public sector and civil society organisations. It's a really diverse membership. We usually get between 25 and 30 individuals coming along from across the sector. The Ministry of Health tends and funds the forum, all of the NGOs working in the space, researchers, academics, ID and sexual health physicians and nurses, and others. Why a consensus statement on HIV prevention in Aotearoa? A little bit of context. Many of you will know that we have a resurgent HIV epidemic in this country. 244 diagnoses last year, which was the highest ever, and really followed on, continuing a trend that started back in 2011 of increasing HIV diagnoses. This isn't only a serious issue for all of those individuals diagnosed with HIV, but indeed for our health system. The cost of HIV treatment alone has doubled in the last 5 years to over $30 million a year. At the same time that we have this challenge before us in Aotearoa, we've seen nothing short really of a revolution in HIV prevention internationally over the last couple of years. And that revolution has been borne out mainly in the context of the role that we now know HIV treatment can play in prevention. So just very quickly, the role that treating people living with HIV can play in helping them to achieve an undetectable viral load, therefore virtually eliminating the chance of onward transmission, and the role that pre-exposure prophylaxis can play if we can get it into the hands of those people at highest risk of HIV because they struggle with consistent condom use for whatever reason. Mathematical modelling and indeed exciting emerging evidence from jurisdictions we already compare ourselves to overseas, such as Australia and the UK, is suggesting that there is enormous potential in embracing and rolling out a comprehensive HIV prevention strategy if we want to tackle the challenge that's before us. So the purpose then was for the HIV Forum to demonstrate leadership in the New Zealand HIV response and really provide an opportunity, I guess, to discuss and debate HIV prevention, identifying where, or indeed if there was, consensus in the sector, including from government, with regard to how we might tackle HIV moving forward. And the overall goal, of course, to create a consensus statement that we as a sector can point to that's specific to New Zealand and complements existing frameworks for action. So it's certainly the intention of the consensus statement to hopefully complement the Sexual and Reproductive Health Action Plan that we're expecting out, hopefully not too far away. The process was as fun as those cartoons suggest it might have been. It was actually the New Zealand Sexual Health Society that penned the initial draft, so Dr. Peter Saxton and Dr. Ed Coghlan, who brought a draft consensus to the March meeting of the forum this year, where it was comprehensively workshopped And we then went through essentially a series of iterations to see if we could land somewhere where all members of the HIV Forum were happy to say, look, this is a statement that we can all stand behind in terms of a direction forward. So it wasn't about making sure that everybody was absolutely happy with every single word and every single line in the document. It was about reaching consensus. So can we all sleep at night knowing that this is the direction that the sector wants to stand behind as a potential way forward? We landed on the consensus statement. It went live online earlier in the year, and indeed you've got a copy of the PDF in front of you. If you haven't already been online and signed on, I would absolutely encourage you to do so. At the September meeting of the Forum in a couple of weeks, we'll be workshopping again how we can ensure that the consensus statement is brought to life as well as possible. What does it say? Well, it says the HIV epidemic can be reversed in Aotearoa by implementing effective HIV prevention actions urgently, to scale and in partnership. These include condoms, injecting equipment, prompt HIV treatment on diagnosis, ongoing retention and HIV care, HIV pre-exposure prophylaxis for those most at risk, more frequent HIV testing and thorough STI screening. These actions need to obviously be supported by a capable workforce, and surveillance of infection and of behaviours, and last but certainly not least, the elimination of HIV stigma. The idea is with a common understanding, a shared purpose and clear roadmap of actions, the HIV epidemic can once again be reversed in New Zealand. Essentially, the statement sets out 6 actions which the Forum has agreed what needs to happen for us to give this a serious go. To interrupt HIV and STI transmission, we absolutely need to find new, sophisticated ways to continue promoting the role of condoms for the protection against HIV and STIs during anal and vaginal intercourse, and of course the continuation of needle and syringe exchange programs. We need to reduce the number of undiagnosed HIV infections in the community, and to do that we need timely, more frequent and widespread HIV testing by improving access to testing services in clinical and community settings. To minimise the transmission and maximise personal well-being of people with confirmed HIV infection, we need HIV treatment to be offered promptly following diagnosis. And of course we've got a significant win in that space earlier this year with the removal of the CD4 threshold for treatment access. And indeed we need to support people to be retained in care and on treatment. We need to get pre-exposure prophylaxis, as I said up front, into the hands of those individuals who are at highest risk of HIV infection because they're unable to sustain a behavioural risk reduction. We need to improve access to comprehensive STI vaccination, screening and treatment. And last but certainly not least again, we need to commit to ongoing surveillance and research into HIV and STI infection and risk behaviours. I just, by way of conclusion, I guess, we are at a watershed moment, if you like, in HIV prevention in this country. And as I said earlier, countries we usually compare ourselves to overseas that are rolling out a comprehensive HIV prevention approach are starting to be rewarded. And we'll hear about one of those examples later in the session. There's absolutely no reason why we in New Zealand can't do the same thing. With renewed high-level political leadership, with comprehensive policy that supports this approach, and I was encouraged to hear comments from the Ministry earlier that they're prepared to back a comprehensive combination prevention approach. And with new, exciting, creative ways for this sector to come together and collaborate, there is genuine potential to not only halt HIV infections in this country, but also reverse them and ultimately end them. So please join us, jump online, sign up if you haven't already, and spread the word. Kia ora.